Okay, go ahead.
We have CMS, Medicare, and Medicaid. So what we're going to cover in our slides is what CMS is, and then we're going to go into the history of Medicare and Medicaid, the different components of Medicare, the federal and state specific issues of these two different programs, and then the beneficiaries of Medicare and Medicaid and how they are funded. Then we're going to go into the Medicare Trust Fund and the projections of when it will become bankrupt.
CMS is part of the Department of Health and Human Services. When its current name was known as the Healthcare Financing Administration. It is currently known as the Centers for Medicare and Medicaid Services. It includes the Children's Health Insurance Program known as CHIP and the Health Insurance Marketplace, which is part of the Affordable Care Act. So what does CMS do? They're responsible for administering the Medicare program nationally, since that is a national program. And then for Medicaid, which is administered by the states, they coordinate with individual states. They're also responsible for maintaining oversight and compliance with Medicare health and safety standards. So in order to use CMS, to be reimbursed by CMS or provide care, certification is required. When a facility is licensed by an individual state health facility, there can be an automatic approval by CMS if they're licensed by a deemed provider, which is the Joint Commission, the Healthcare Facilities Accreditation Program, or the Det Norske Veritas Healthcare. If they're not going through one of those three programs, they can apply for certification after they're licensed. The state survey agencies do the actual inspections and licensing, since CMS doesn't. They also identify potential healthcare participants, conduct investigations and fact-finding surveys, do actual certifying and then recertifying when the certification is expired, and explain requirements to the facilities.
So the history of Medicare, you can trace it back to as early as Teddy Roosevelt in 1912. He didn't start Medicare, but he did have a platform of introducing the nation to insurance. A nationwide insurance program funded by the government. You can see the picture below. It's Lyndon B. Johnson. He was able to sign a bill that led to Medicare almost 50 years later, or a little over 50 years later. In 1965, the budget was around 10 billion, and 19 million signed up for the first year. And then in 1972, Richard Nixon expanded that program for those under 65 to receive Medicare. There are 4 different parts of Medicare: Part A, B, C, and D. Part A and B are referenced to as the original Medicare. Part A covers more of the facilities, like inpatient hospital care, inpatient stays, such as skilled nursing facilities, and hospice and home health. And Part B you could categorize it under labor, doctors and lab expenses, outpatient care and preventative, screening and surgical supplies, physical and occupational therapy. And then we're going to skip to Part D. That takes care of prescription costs and can be a standalone policy. C is known as a Medicare Advantage plan. It can cover different parts of A and B and D. It's known as MAPD. So that really plays a role in kind of statewide, can be tailored to what also an individual needs. And then there are different ways you can qualify for Medicare. So we're going to cover a little bit. The U.S. resident, you have to be a U.S. resident for 5 years or a permanent resident. Your spouse has to have worked long enough for Social Security. Your spouse your spouse can work for the government, and they have paid Medicare payroll for the taxes while working. And then for those under 65, you have to be entitled to Social Security benefits for 24 consecutive months, receive disability from Railroad Retirement Board. And the next 2 cover diseases, Lou Gehrig's disease or permanent kidney disease. Your spouse still has to have paid Social Security taxes for a certain amount of, depending on the age of the individual. So Medicare finances, according to Medicare.gov in 2011, covered 48.7 million people, costing $549.1 billion. In 2014, 14% of the whole federal budget went to covering just Medicare. About a quarter went to hospital, inpatient care, 12% went to doctors, 11% went to prescriptions, and then another quarter went to covering private healthcare plans that covered parts A and B. So this next slide really breaks it down in the different funding. So Part A, 2.9% of tax earnings paid from employee and employers. And then Part B comes from the general revenue of 73%, and then beneficiary premiums of 25%, and interest and other sources of 2%. And then Part D comes from the general revenue of 74%, beneficiary funds of 15%, and then payments for dual eligibility of 11%. So then Part C, that one does not have separate funding.
Okay, so to cover a little bit of the history of Medicaid, it was authorized by the Social Security Act, and it was signed into law in 1965. And at first, the federal government established these certain requirements for all the states to follow. And each of the states then could administer their program, and that resulted in a couple of different variations from state to state. But in 2014, with the Affordable Care Act, Medicaid went and standardized all the rules for determining eligibility and providing benefits. And so it was kind of across the board for each state as far as what Medicaid covered. The beneficiaries of Medicaid, federal law requires that states cover certain groups of individuals, and that's included low-income families, qualified pregnant women and children, and then individuals receiving supplemental security income. I thought it was interesting that it covers over 72.5 million Americans. So that's the single largest source of healthcare coverage in the United States. The Medicaid funding is funded jointly by the government and the states. So the government pays the state a specific percentage, and it's called the Federal Medical Assistance Percentage, and that percentage is determined based on the income per capita per state. And this is a slide that just kind of shows very clearly the differences between Medicare and Medicaid. Sometimes they can get confused, but this really lays it out as to who qualifies for who.
The Medicare Trust Fund is paid through by two trust fund accounts held by the U.S. Treasury. These funds can only be used for Medicare. One is the Hospital Insurance Trust Fund, known as HI, and the other is Supplementary Medical Insurance Trust Fund, otherwise known as SMI. The HI Trust Fund is funded by payroll taxes paid by most employers, and those self-employed, income taxes paid on Social Security benefits, interest earned on the trust fund investments, Medicare Part A premiums from people who aren't eligible for premium-free Part A. HI Insurance Trust Fund pays for Medicare Part A, which is hospital insurance, inpatient hospital care, skilled nursing facility care, home health care, hospice care, and Medicare program administration. The projected depletion of the HI Trust Fund is in 2028, which is 2 years earlier than projected in the last year's report. The HI Fund fails the test of short-range financial adequacy as its trust fund ratio is already below 100% of annual cost and is expected to decline continuously until reserve depletion in 2028. Supplementary Medical Insurance Trust Fund is funded by funds authorized by Congress, general revenues, premiums from people enrolled in Medicare Part B, and Medicare prescription drug coverage, which is Part D. Special payments by states, fees on manufacturing and imports of brand name prescription drugs, and earned interest on trust fund investments. SMI Insurance Trust Fund pays for Part B, which is physician, outpatient, and home health services, and Part D, the prescription drug benefit, and Medicare program administration. As far as the projected depletion for the SMI Trust Fund, it is anticipated that both Part B and Part D of SMI will remain adequately financed into the indefinite future because current law provides financing from general revenues and beneficiary premiums each year to meet the next year's expected costs. And these are our sources that we all use to create this PowerPoint.
Awesome. Great work, guys. You covered the topic really well. Excuse me. So I'm going to go ahead and stop recording here really quick, and then we'll talk in just a second.